Hello, and welcome to this education session on subcutaneous medication injections. So with subcutaneous medication injection, the most common medication we're going to use outside the palliative care program is enoxaparin. This is a high alert medication, so whenever it's a high alert medication, we want to make sure that we're double checking all of our indications, contraindications, and of course checking our math with our partner to make sure that we're calculating doses effectively. The other big thing to remember about administering this medication is we do not give it to our patients without physician direction, especially for our STEMI patients. So we need to get approval before we give this medication. So when we look at enoxaparin itself, we can give it IV or subcutaneously. So the reason we'd want to give this medication subcutaneously, there's a couple different reasons. One is that if your patient is over 75 years of age, they're at increased risk of bleeding, so we want to go subcutaneously as opposed to IV. The other thing as well is when we look at dosing, for patients under 75, if you're going to give it IV, you can only give up to 50 milligrams. So if you have a patient that is under 75 and the physician directs you to give 100 milligrams, you're going to have to go the subcutaneous route to administer that medication. So those are a couple of reasons why we'd pick subcutaneous versus IV. So with that, when it comes to subcutaneous injection sites, there's a lot of different varieties here. When it comes to enoxaparin, the abdomen is actually the preferred site. So when we use this area, we want to just make sure we stay away from 2 inches from the umbilicus or from the belly button. Another consideration we have to have is if your patient is self-administering any medications into their abdomen regularly, like insulin or their own heparin, we could ask them where their last injection was, so we can pick a site away from it, so that way we have better chances of absorption. So we're going to get our equipment together. So we're going to need alcohol swabs because we're going to clean the site before we inject into it. We're going to get our enoxaparin out, and we're going to make sure that we check our concentration, our dosing. Again, high alert med, we're going to make sure we've got the right ampule. That's always a big one. And if we're taking it out of the vial there, we're going to need a vantage point syringe because that's why we have them. Okay, so these are the only ones we should be using for subcutaneous. Do not use an IM needle for subcutaneous. Use the subcutaneous needles that are provided. Sometimes pharmacy will also give us preloads. If you have a preload, that's fine. You don't need the vantage point or anything like that. It's all in the one syringe there, so you can just use that. The administration steps would be the same. You just don't have to drop the med first before you give it. So we're going to calculate our dose. That's kind of a big deal. We need to know how much we're going to give. So let's say we have a 76-year-old male that weighs about 179 pounds. That's the weight that they give us. So we're going to calculate our dose here. But first thing we have to do is figure out our kilograms. So we take our pounds, so 197, divided by 2.2, and that gives us 90 kilograms. Okay. Next thing we're going to do is we're going to figure out what's our dose. So our patient weighs 90 kilograms. Because they're 76, they're over 75. So we're going to times it by 0.75, because if they're over 75, we do it by 0.75. And that gives us a dosing of 68 milligrams. Next thing we're going to have to figure out is how many mLs we're going to need to draw out of the vial there. So we do our dose desired. So our dose desired is 68 milligrams over our dose on hand, which as you can see on the vial there, it's 300 milligrams in the amount of mLs. So again, so our dose desired over dose on hand times how many mLs? So 68 divided by 300 times 3, and we're going to drop 0.68 mLs. So again, we're going to do our patient rights. We're going to make sure it's the right medication and check the concentration. We're going to get our vantage point syringe out. We're going to draw up the air we need. So we're going to draw about 0.7 mLs of air because we need 0.68 of the medication. Just going to push the air in there just like we would with any other medication draw. The big thing to remember here though is when you push that plunger up, you have to make sure you don't push it all the way because it'll push the spring that retracts the needle back into the syringe. The other thing here as well, as you can tell, it's coming out a little slower. It's a very small needle, so sometimes you just have to give it a little bit to fill up as opposed to flooding into the syringe. And once you got your medication drawn up, you're ready to administer. So with that, as you can see the picture here, ideally we're going to be giving this in the abdomen. So what we're going to do is we're going to landmark, again, just making sure away from the umbilicus. We're also going to take a look at the area as well. We want to make sure we're not using anywhere there's already bruising because the patient might have taken a heparin or something earlier in the day as well. And we're also going to make sure like there's no skin lesions, infections, anything that on the abdomen of where we want to inject it. So we have to make sure that it's actually a good site. First thing we're going to do once we pick our site is we're going to swab the area. We don't want to rub it very hard. We're just going to give it a light swab because any aggressive, vigorous cleaning can cause bruising because we're going to be giving enoxaparin in that site. So we don't want to risk any extra bleeding or bruising. We're going to take the cap off our needle. We're going to get the bevel up. We're going to pinch a good size of skin there, but not too hard, so we're pinching them. And we're going to go in at a 45-degree angle. Once we're in, we don't aspirate for blood. We just start administering the medication. And once we're done, we pull it out at the same angle we inserted it. And then, like I mentioned before, we push the bottom of the plunger, retracts the needle, and medication is administered. And that's subcutaneous medication injection. Thank you very much. And again, make sure once you've given your medication, you document appropriately, you did all your patient rights, you went by the high alert medication standards, and that everything was documented appropriately. Thank you very much.